Hi, hello, welcome back. So today we will be seeing about heart including valves and great vessels procedures 333002 33340. So this is a topic which is coming under CPT cardiovascular. You can have a clear view of this topic in this video. So understanding the CPT codes related to the heart including valves and great vessels, specifically 3300 to 33340 is essential for accurate coding. Here is a detailed breakdown of definition, example, description, tips and conclusion. So first we'll start with introduction. The code series 3300 to 33340. These codes cover the procedure related to the heart valves and great vessels. The heart valves are aortic, mitral, pulmonary and tricuspid, will be regulating blood flow through the heart. Definition for heart valves: structure that ensure unidirectional blood flow through the heart chambers. Aortic valve is a valve present between left ventricle and aorta. Mitral is present between left atrium and left ventricle. Pulmonary valve and tricuspid valve. So here great vessels, large vessels that transport blood to and fro from the heart. Aorta is distributing oxygenated blood from the left ventricle to the body. Pulmonary arteries are carrying deoxygenated blood from the right ventricle to the lungs. Superior and inferior vena cava returns deoxygenated blood. So examples for this is, for open mitral valve repair, for mitral valve regurgitation, we are using CPT code 3330, that is repair of cardiac valve open approach. And second example is aortic valve replacement with a bioprosthetic valve due to aortic stenosis. For that we will be coding 33305, valve replacement open approach. Description of this code is replacement of heart valve with a prosthetic valve via open surgery. Third example, mitral valve annuloplasty for mitral valve prolapse. CPT code we are using here is 33310, annuloplasty. Description of this is surgical repair of the valve annulus, that is a structure, ring-like structure at the base of the valve to improve valve function. Fourth example is balloon valvuloplasty for a stenotic aortic valve. For this we are coding 33320, valvuloplasty percutaneous approach. So description of this is non-surgical repair of a heart valve by a catheter inserted through the skin. Next example is TAVR for severe aortic stenosis in high-risk surgical patient. For this TAVR procedure, we are giving 33330, that is transcatheter aortic valve replacement. Description is, it is a minimally invasive replacement procedure of aortic valve. Next example, pulmonary thromboendarterectomy for chronic thromboembolic pulmonary hypertension. For this we are coding 33340, pulmonary thromboendarterectomy. Description, surgical removal of thrombus from the pulmonary arteries. Tips for coding is, you have to go through the comprehensive documentation like which vessel is involved, what type of approach is used and any prosthetic device is used, that you have to go through. And specificity is, choose the correct code from the CPT book, and if any modifiers is implemented, please do assign the modifiers without fail. And finally the conclusion part, by applying CPT code 3300 to 33340, we will be getting a correct code for the procedure. And you have to encompass a range of procedure related to the heart procedures. So hereby I have given the codes and procedure done as well as description with example. You can have a view of those things and make sure you are understanding it, and you can readily apply or implement in the question which we are going to practice. So that's all about this topic. And if you are watching my channel for the first time, please do subscribe. And we have added a playlist also for all the CPT procedures. You can go through that playlist for clear understanding of CPT topics. And hope so you found it interesting, and please do subscribe and keep, so that you will get regular updates of all the videos. Thank you so much. Thank you for your time. Take care. Bye bye.